Broadcast is now starting. All attendees are in listen-only mode.
So welcome to the webinar about the Master of Public Health program here at the University of Indianapolis. We are very excited to have you with us today. My name is Dr. Heidi Hancher-Rauch, and I am the Program Director for Public Health here at UIndy. We also have on the line one of our second year MPH students, Aubrey, and she will talk to you a little bit later about the internship that she is planning, and then maybe toss in a little bit of other information for you about the program overall and her experiences. So we're glad to have you with us today. So for those of you who are a little bit unfamiliar with public health, you have a definition here from the Centers for Disease Control and Prevention. But overall, what I think I would really have you take away from the overall definition of public health is that we are all about improving the quality of life for people who exist in communities, small and large. So these can be people very immediate to you, such as family members, friends, all the way to global perspective and focus on global health. We do that through is the easier choice. We also do a lot of healthy living, health promotion types of activities with individuals and communities. And so really our overall focus is about reducing the incidence of and prevalence of disease, and then just working to prevent illness and disease overall. So this is a photo for you of the health pavilion. This is where you would be visiting when you come for in-campus intensives, and I'll talk about those a little bit further into the webinar. But this is the building where physically the public health program is housed at UIndy, and this is a brand new building that is part of our campus, and so one that you will frequent for things like orientation or the once a semester weekend intensives. So how is public health different from healthcare or medicine? And this is a question that I receive pretty frequently because we have a lot of people in public health who maybe are trying to figure out how is this different from say being a nurse or a physician. And there is overlap in that we are working to prevent illness and disease and prevent the spread. But at the same time, whereas your physicians are more focused on, say, what we would consider medical care, and the focus is mainly the typical disease model, which is, they wait until somebody shows up in the physician's office and receives a diagnosis to then talk about changing in eating behaviors and physical activity in the environments in which people live. And then they treat it from there, and they use for us in public prevent those individuals from developing the disease outcomes at all. So trying to prevent the diabetes on the front end, or try to catch it really early and create an environment where the individual can prevent, say, pre-diabetes from turning into diagnosis. So we are really focused in the areas mainly of primary and secondary prevention or beginning, or secondary prevention is that create environments where and work with individuals to try to reverse the incidence of disease. Whereas a lot of our medical professionals focus more on the treatment and true medical side. So that's a little bit different from what we do in public health. And here's a slide that kind of outlines that difference for you. We the term communities a few times. And it may be we do some work obviously on the individual level, but our focus is really create those healthier environments for people and educate them on service mentality. We are centered in social justice, and we'll talk a little bit about that later. So the focus for public health is all about this disease. And the way that we intervene is really on a pretty broad spectrum. So I've talked about a couple times already that focus on trying to create environments where a healthy choice is the easier choice. We also do work with individuals and focus on their individual behavior, or help them make behavioral choices that are hopefully healthier, and so making those lifestyle changes, and then also direct them toward medical care. But we also have physicians and nurses who get MPH degrees so that they practice more in public health medicine. So that is a specialty area of medicine that is an interest for a number of individuals. So if you were trying to figure out, if you were describing public health to somebody else, like let's say you were talking to a family member maybe who was saying, well, tell me about this public health thing that you're considering for a master's degree. One thing that I would definitely and social justice. We are very focused on trying to create a system where everybody has a fair shot when it comes to health and health outcomes. We know that there is significant health disparity in this country as well as across the globe. So we very much are focused on trying to create these environments that are more equitable for individuals so that everybody has access to high quality healthcare, that everybody has access to environments where they are able to practice healthy behaviors and live safe and healthy lives. Public health also really centers on prevention. So you heard me mention both primary and secondary prevention, which is where we mainly focus in public health. We try to, again, create situations where people are able to prevent disease or catch it very early and be able to then hopefully have a reversal of that disease and move into the healthier behaviors as an option for those individuals. And we also definitely are focused on improving the health and well-being of people in communities. And when we talk about communities, that can be from a very small C community. We do work in places like nonprofit organizations, and we go in and do programming sometimes in churches or small gathering spaces, all the way to globally focused on health communication campaigns, global public health. So depending on your specific interest, you really can find a niche, anywhere in there, from the very small scale to the very large scale. So what are some of those career opportunities then that maybe would be open to you? The U.S. Bureau of Labor Statistics does predict that public health is going to be an area of continued growth over the next few years and even beyond. And part of that is because touch so many different areas of communities that it makes it easier for individuals to find a job within an area that's of interest to you. So we work in places like your typical healthcare settings. We're in hospitals, we're in physicians' offices, religious affiliated institutions. We write grants, and that often people who are very interested in writing grants and grant making, they often work for government organizations like the Indiana State Department of Health or the Marion County Public Health Department, or even more frequently than that, they may be in some of those nonprofit or non-governmental organizations. They need a lot of individuals who are focused on being able to bring in grant money for them. So that's something that we cover in our program. We also work in civic and professional organizations. There are many professional organizations areas of health, and then in some social assistance programs and in educational institutions. So I would say the main places that students who graduate from our program that are interested in, a lot of them are focused in the nonprofit area. Some of them are really interested in doing social justice work at the local level, but we also have students who want to do public health programming, intervention work at the global level. So lots of different opportunities there. State and local health departments. I said the nonprofits, different various types of work sites. So employers sometimes hire people with a public health background to do employee health and wellness types of activities. So there are just many different and varied types of career opportunities when it comes to public health. So one of the things that we really try to do within this program is help you find your specific area of interest and where your passion lies, and then help make those connections for you with individuals who work and are leaders in those areas, so that we hopefully can have that lead to internship and career opportunities. So what are some of the job titles or specialty areas within public health? Some of the most common include community health education, epidemiology, biostatistics, health policy and management, global health, environmental health, and then health disparities, which is the specific concentration of our program here at UIndy. You definitely will take courses in, say, epidemiology and biostatistics. There's a specific course also related to health policy and advocacy. We have a required global health course and an environmental health course. But then you would see threaded throughout our entire program this focus on health disparities, because that is our specific concentration. So you get that foundational knowledge in all the required areas of public health, but then concentration in health disparities, where we really try to dig into more of that, the reasons behind all of these health inequities, the unfairness, the injustice that exists, that impacts health in our country and globally, to then really try to dig in and see what we can do about that in public health. So what are the options that we have in front of us to make a difference? So there's another slide here that talks to you a little bit about where else might you find the MPH graduates. Similar to what I mentioned before, you see us in healthcare settings, and around Indianapolis, we have a number of healthcare systems that are partners for us. So we have opportunities to place interns there, but wherever you are, wherever you live, your home community, you likely have healthcare settings near you also that could be partners for the work that you do through our program. Businesses, so health insurance companies hire people with public health backgrounds. You also see, as I mentioned previously, the employer-based wellness programs. That's an area for employment. Then you have, through government, your local state health departments, and then there are also a number of nationally focused health organizations. And just one example would be the Centers for Disease Control and Prevention. You also heard me talk about nonprofits. Just here around us, we have organizations like the American Heart Association, American Cancer Society, the Multiple Sclerosis Foundation, we have Social Health Association, all kinds. There are so many different nonprofit and non-governmental associations that are focused on health. Susan G. Komen is another example where our students have been in the past. March of Dimes. So we have lots of opportunities to place students and work alongside those kinds of organizations. We also have some with a global focus, like TEMI Global Health and Immigrant Welcome Center. Those are just a couple examples of more global health focused types of nonprofits. And then there are also some international non-government organizations if you have that focus of wanting to do some work globally. And Aubrey here in a couple minutes will talk to you about one of the organizations she has teamed up with to complete her internship that's coming up here very soon. So what are health disparities? If that's a term that is unfamiliar to you, I mentioned that this is our specific concentration here at UIndy, but just so you have a foundation in terms of, what is that? What does that mean? Well, we are a professional program with this concentration in health disparities, which are the preventable differences in health of various populations. So what we do is look at some of those data and statistics that show us that if you just look at the United States States, for example, we see wide variations on the health outcomes for people who say even just live one county next to each other. And a lot of that has to do with income variations. And then we also really look at then how is that tied to things like race and ethnicity and gender. What impact does that have on individuals' access to healthcare? Where do they live? What are the environments like where people are existing within these communities, and how are the resources different for different groups of people? And then what can we do from a public health perspective to try to address those injustices, those unfairnesses that impact those health outcomes for individuals? So why is it that people who live in X neighborhood tend to live 5 to 10 years less than people who live in Y neighborhood? What is that difference there, and what can we do about that? So our program really is centered on the core public health value of community collaboration and social justice. So if that's something that's interesting to you, you do have the opportunity to kind of thread that throughout the work that you do in various courses across the program. So we do intentionally work to combine your academic preparation in the core areas of public health knowledge and skills, and then our program really embeds that within the community. So instead of discussing theoretically maybe what a program would look like, or you go out into a community and work with community members to impact their behaviors, instead of just talking about it, we do it. So we connect you with, or help you connect with organizations within your community, wherever that is, so that you can really practice those skills of community intervention instead of just talking about it from a theoretical perspective. So we work really hard across the program to make sure that our students have that opportunity to participate in many community-based types of projects. And this program does include an intensive professional practice experience. This occurs at the very end of your program, that final summer, where you will have a capstone course and then the internship course, and you will be required to complete 200 hours for that professional experience. That happens over a 14-week period of time during the summer, and we have a number of students who continue to work during that. Some of them work full-time. It can be a little bit challenging if you are working a full 40-hour week, but we've had a number of students who have done it. It's just a little bit trickier in that instance. You have to find a community organization that will really work with you on a very flexible schedule. So a community organization that has a lot of, say, evening or weekend events where they need help, and then they have the flexibility of allowing you as the intern to do a lot of work that is kind of on your own, and then submitting it through your supervisor. A number of our other students try to cut back on maybe their regular work hours so that they have a little bit more flexibility, or perhaps they work 3 to 4 days a week at their current jobs, and then will use the other 1 to 2 weekdays to really focus in on their internship work. And then we have some students like Aubrey who are choosing to do a global experience and go live and work and practice in another country for a period of time. So we really try to work with our students and create a scenario for them that works based on your schedule. So there are lots of different ways we can work out the internship experience, but all students will have to complete that 200-hour professional practice experience at the end of the program. So what does our format look like as a program? We are a 45 credit hour program, which is very consistent across MPH degrees. It's designed to be completed in 2 years, including summers, but we have developed curriculum guides that allow students the opportunity to kind of slow down and do that at a slower pace. So you can do it in a 3 or a 4-year format if you are somebody who really wants to continue to work full time and maybe not take as many credit hours. You don't want to or need to be a full-time student while you're working on your master's degree. So really it can be a combination of what works for you as the student. It is a combination of online and hybrid. So the vast majority of your content is delivered via the online format, which really gives our students the flexibility to work at their day jobs and then also still be engaging in their master's level courses. And we do have typically approximately 1 weekend per semester where students will be required to come to campus for a weekend intensive. And during those intensives, that's really our opportunity to give students kind of the richness that you would get from face-to-face meetings that you can't get in a fully online format. So that's our opportunity to bring leaders in the public health arena to campus to meet with students and talk about their specific areas of interest and expertise in public health, to allow our students to network with those professionals. We do field trips, go out to community and public health organizations, and really try to dig into, say, components of health disparities that are not always evident or readily available to you just in the online format. So we think that hybrid format really gives us the opportunity to be flexible for students, but also provide a richness that you can't get in a fully online program. So if you did the traditional 2 years plus summers, the 2-year program would require approximately 5 trips to UIndy campus. That would include the orientation that would happen right before you kick off your first semester. And you have information there about our current tuition rate. So now let's talk a little bit about that real world opportunity. You heard me mention quite a bit that our focus is about building these community partnerships and getting you out into the community wherever that community exists for you. So in Indianapolis, when you're here for the intensives, or if you live near Indianapolis, or we will really work to connect you in the community wherever that might be. So here's a photo of Peyton. She was a student who graduated from our program last year, and she did her internship in Ghana. So she chose to do, she was very interested in something that was very much service focused, and she wanted to go internationally. And she ended up having just an amazing experience where she worked with children in Ghana. And then Aubrey is getting ready to head out here very soon for her internship. And we have her on the line, and I wanted to give Aubrey a chance to kind of talk to you about what she plans to do, how she is kind of working that into her schedule and making that work within her life, and maybe offer any other tips that she wanted to share about the program. So Aubrey, are you available and ready?
Yep, I'm here. Hey everyone, my name is Aubrey Heron. I'll give you a little bit of background about myself before I talk about the internship. So I'm from Noblesville, Indiana, which is about 45 minutes from the school. And this summer I will actually be going to Uganda with an organization called Go Be Love International. Just like Peyton, I am looking to utilize my internship in a service-oriented way. So I'll tell you a little bit about how I found it. But first, I just want to preface that, like Dr. Rauch said, many of us do have full-time jobs. I currently am an account executive at a laboratory information system company. So we sell laboratory software to public health departments, hospital systems, physicians all over the country. So Dr. Rauch is correct. It is somewhat daunting to think about working full-time and doing an internship, but the school is very helpful in making it work for you. And as long as you put in the time and effort to find a niche and an internship that you're interested in, you can pretty much utilize the internship opportunity in any way that you want to. So I spent a summer in the Gambia, which is on the west side of Africa, my sophomore year of college, of undergrad, and I was there researching dental health. When I was there, I fell in love with global nonprofit work and just healthcare at a global level. So through much of my time at UIndy, I've been focusing many of my projects and papers and just everything that we do around global health disparities. I really do see myself in the future starting a nonprofit. I'm just not sure specifically as to what for yet. But so I knew that this internship was coming after year 2, in the summer of year 2. So I've been working really hand in hand with Dr. Rauch and several of the other staff members on how to mold this internship into something that will work for me and my lifestyle. I'm not able to take off days or weeks or months to complete this internship, but I was able to find a organization. They're a nonprofit called Go Be Love. They were formerly known as Visiting Orphans, and they do a lot of work with orphan ministry. So they travel to countries all over the world, not just Uganda, and they serve orphan populations, which, just to preface, there's 147 million orphans in the world today, and Uganda, where I'm going, has 2.7 million orphans. So I just really have a heart for orphan populations and global nonprofits, and that's what drove me to look into this. But I was able to connect with a girl who has her MPH from Australia, actually, because one of the requirements for the internship is that we have someone that overlooks our work in the organization that has an MPH. And that was a really cool thing to be able to connect with somebody who also has their MPH on what I wanted to do. So we're going in the month of June. We'll be there for a few weeks. And I'm actually taking my husband along with me because I want him to kind of help and experience that for himself too. But we'll be working with orphan populations in several parts of Uganda. So what I really want to focus my internship and research pretty much on is mental health in orphan populations. I've connected with a psychologist here in the States and have spent several hours with her about what to look for in orphan populations, as many of them aren't given the development and the love and affection at an early age, and how that can affect mental health down the line. So through the time there, I'll just be really experiencing what it's like in Uganda, researching, talking to officials there, working with the girl that I mentioned, Chloe from Australia, and putting together a comprehensive public health pretty much analysis of what that population needs in Uganda, and then pretty much utilizing everything that we've learned throughout our 2 years at UIndy into the project that we'll have due this summer. Dr. Rao, do you have any more questions?
No, Aubrey, that was fantastic information I think that you provided for them. If anybody has a question that you specifically want to ask Aubrey, you can feel free to type it in, and we can make sure that she sees that question at the end and has a chance to respond. So thank you so much, Aubrey, for sharing that information. I think that was really helpful for people to kind of get a perspective from a student in how you have made that work. And I can't wait to hear about your internship when you get back. I think it's going to be a fantastic experience.
Well, thank you for working with me to make it work, and I look forward to hearing how all of you guys utilize the internship as well.
Thanks, Aubrey. So something else we wanted to make sure we mention for you today is the professional development opportunities that we provide. If you are somebody who is interested in really doing some research or participating in professional presentations at state or national conferences, we are more than happy to work with you to make that happen. This is a picture of me actually with 3 of our MPH students who are just finishing up their 2nd year. We recently traveled to the National Conference for the Society for Public Health Education, and they presented some work on advocacy that we had been doing. So it was called Creating Health Advocates Far and Wide. Our faculty here have a really diverse research interest and presentation interest, and so if you want to participate in something like that, you absolutely could do that. We go to conferences like the American Public Health Association. I mentioned Society for Public Health Education. I'm going to take some students this fall, hopefully, to the SOPHE Advocacy Summit, which is something we're submitting some proposals right now to present at this conference, where we go and receive advanced advocacy training, and then we meet with legislators on the Hill. And this year, our advocacy topic is gun violence, so we're going to be talking to our federal legislators about passing some gun policy to protect individuals in our communities. So I'll talk to you a little bit more about the faculty here in a few slides and their research interests specifically, but just know if you have a public health related research interest, we can connect you with people so that you can research in those areas and share out your information at state or local conferences. So the faculty members, they're myself, I introduced myself at the beginning, Dr. Hancher-Rauch. My areas of expertise really kind of fall around community programming, so this idea of community health education, so creating programs or interventions, implementing those and evaluating them. I'm also very passionate and work in the areas of health advocacy and policy, so I teach the health policy course, and like I said, I am getting ready to take students to DC here in the fall, and I serve as the co-chair of the advocacy committee for the Society for Public Health Education, so you may know them as SOPHE. I also do some program evaluation work. For example, there's a program that a colleague and I have been working on with the Indiana Minority Health Coalition that is focused around mental health promotion occurring in communities, and we are serving as outside evaluators for that, where we work with them on creating evaluation tools and then collecting that data, analyzing it, and sharing out information on program effectiveness and ideas for improvement in the future. So those are just a few of my areas of expertise. I also have some research going on related to T21, or what we call tobacco 21, which is raising the tobacco age from 18 to 21. So I'm conducting some research in that area. I also do some research with professional colleagues across the country relevant to certifications in public health and the certifications that different public health programs recommend for their students, and then trying to promote more the CHES and CPH credential, which stands for Certified Health Education Specialist, or the Certified Public Health Individuals, which are the two main certifications for people who practice in the areas of public health. Dr. Voitna is another one of our faculty members. She has a specialty area of epidemiology. She has worked for the State Department of Health in Indiana, as well as the Centers for Disease Control and Prevention. She really focuses on surveillance, epidemiology, outbreak investigations, enteric diseases, which are kind of some of your, she explains it as anything that makes you vomit or have diarrhea. Those are kind of her areas of expertise. I know that sounds really interesting, right? And then also antimicrobial resistance, that's something else. So anything that's epi related, but she also has really developed a current interest in kind of urban gardening and what it takes to, tackle food deserts and create these urban gardens. So she's been doing a lot of work around the south side of Indianapolis, focused on that. And she has ideas for people to implement these types of things in communities wherever you exist. So if that is of interest to you, she definitely has some recent experience in urban gardening and food deserts as well. We have Dr. Kara Cecil. She works more with older adults and focused on risk mitigation. How do we protect vulnerable adults, say, in times of disaster? So think of, the hurricanes, tornadoes. Those are a couple examples where we saw older adults be at high risk recently. So she's all about trying to create plans for, say, senior living facilities or communities or state departments of health to figure out in some type of emergency, how do you make sure that vulnerable adults are taken care of? So older individuals, how do you move them if they're in the hospital or if they're in senior living facilities? How do you make sure those people are taken care of? So that really is an area for her expertise. So if you're interested in aging, and maybe you haven't thought about that as a public health area of expertise, but she really combines public health and kind of gerontology practices. So if you have that interest, she does research in that area. And then Dr. Angelita Britt-Spells is our newest faculty member, and she teaches our biostatistics course. She has a very strong research type of background, but she also has a strong background in health disparities in this she has done some research with like big data sets, Medicare, Medicaid data sets focused on quality of care, access to healthcare for individuals, and then the policies around those. But she also really has a heart for, focused on reducing and eliminating health disparities. So she does a lot of work in the environmental area, where we focus on changing environments to be health supportive instead of detracting from individuals' abilities to practice healthy lives. So we're really excited to have her as a new faculty member for us. So those are the four main, core faculty in public health. And then for those of you who are interested, and we hope you will consider applying for our program, you need to have a bachelor's degree or be finishing it up by the end of August in order to start our program. You need to finish up by like August the 17th to start our program the following week. An undergraduate GPA of at least 3.0 is what we seek. It is very helpful and required to have some type of college level research methods course or a statistics course with a B or better within the last 5 years. Or if you've been out working in the field for quite some time, if you provide evidence of ongoing research activity. We just want to make sure our students are set up to be successful in the biostatistics course, which is a requirement of any master's program that you may be considering. So if you have questions about that or whether your course would count, obviously if you get in touch with our admissions people, they are very good at letting you know the types of courses that would meet that requirement. And then if you don't meet the 3.0 or higher requirement for the undergraduate GPA, then you would take the GRE, and we would need to see that you have taken the GRE within the last 5 years. So you need to meet one of those two, that bachelor's degree of 3.0 or higher. If you have that, you are not required to take the GRE, but if you do have that undergraduate GPA of less than 3.0, we would need you to take the GRE. So to apply, you have the website here. Priority deadline is July 1st. We really would like individuals to apply as soon as possible. We will be picking our graduate assistants for the next year, and that application deadline is also July 1st. So we do have 2 graduate assistants in the MPH program, and these individuals receive tuition remission as well as they are paid for 10 hours of work per week. So if you're interested in applying for those, we are accepting those applications right now as well. And if you contact me or reply to someone within admissions and say that you participated in this webinar, we will reply with a code so that you do not have to pay the application fee. So are there any questions for me? If you have any questions, you may type those into the comments and questions box. Okay, it doesn't look like we are receiving any questions at this time. So if you think of anything, you can feel free to reach out to me. You have my email address there. It's Rauch, R-A-U-C-H-H @uindy.edu. Or you can call me. You have my office phone number there. I will tell you, during the summer, it's a little harder to get in touch with me. I'm leading a spring term trip to Belize, so I'll be out of the country for the next couple of weeks. But I will be checking email, and you can definitely feel free to shoot me an email and ask me any questions that you might have. So I really want to thank you for taking the time out of your day today to join us. I also want to thank Aubrey for taking time out of her day to share her experience with you and talk to you about her internship. And we really hope to hear from you and receive an application in the near future. So thank you very much. And that will conclude the webinar.